this was a panel focusing on the health of women as an economic value, and it began with a presentation on technologies in healthcare. The important thing to think of is we in public health and in global health in the global health world often try to get people to focus on healthcare is critical, but we have to think of health beyond healthcare. And if we're thinking of the economic empowerment of women, we have to think of what that means in terms of a holistic approach to health. The World Health Organization is actively involved in a campaign for universal health coverage right now. And so there's a lot of focus on the continent of Africa in bringing digital, state-of-the-art global health to the continent. That's fantastic and very important. But epidemiologists and others like myself say, what do we know about the population? Is the population ready to engage this kind of digital access to health care? And how will they engage that? And how do we ready the population? And in order to think about those things, one of the questions for this panel were, what are the things we need to be thinking of when we think of technologies in healthcare? So the discussion began from the perspective of population health, where Dr. Alex Hazay talked about the social determinants of health from a demographic population perspective. And that's important because, first, we have to understand the epidemiologic perspectives at the population level, the social determinants, and not just from the perspective of those of us in the academic and et cetera community, but from the people who we are reaching. So what are the needs of women in a community? So we started at the community level and the municipality, the national level, et cetera, on the premise that if a woman is healthy, the family is healthy, the community is healthy, the country is healthy. So, but if a woman is taken up with taking care of everything else and not herself, then her health needs are suppressed. So we have to think about that. Accessibility, recognizing what health means from the perspective of a woman. So the panel was focused on that, even though it began with a keynote around technologies, but then brought in the population, the community level aspect of it, and examples from the field, the dynamics, and fundamentally we're talking about what are these social determinants, social constructs that impact the health of women as economic drivers in communities. So the idea behind the Way Health Cluster is, as a Way board member, I've been tasked with infusing health into the whole paradigm of women's economic empowerment and imperative. And so the idea behind the Way Health Cluster is to create an army of doers who can help us achieve that goal. In these two panels, this plenary panel that I just talked about and the breakout session that went after that, were all developed and geared towards launching that perspective at this conference for the Way Health team to carry forward. So the breakout session, the keynote was on geographies, how geonarratives and geospatial thinking can help us to understand the dynamic movement of women in communities and how that impacts their health. So it's very powerful. Dr. Maypo Kwan does these three-dimensional maps of movement of people. And then it followed on with work being done the urban health model in El Salvador and how that links to women's health. And more specifically, in Latin America, we have a critical issue of violence against women. And we had a very, very empowering photo of 552 shoes in the central city of San Salvador that was staged yesterday for Violence Against Women's Day. 552 shoes represent 552 women killed up to this point for the year in El Salvador. Many of these women are professional women. One woman is a physician who was killed by her husband because she earned more money than he did. So there's that intersection, and that is part of health. So you're asking women to be economically viable, but their communities and their people in their lives are not ready for their economic viability, and that causes them to lose their lives. And so then we had a look at community mapping in India around the health of women, and how can we use those community maps to highlight and signal where we need to intersect. That brought out the point from a discussion in the room of people who said, why haven't we heard about this before? A filmmaker said that, and another person says, and I said, this is exactly why we have something like this at a way meeting, because most of us in public health and global health, it's an echo chamber. We talk to ourselves at the meetings we go to constantly around the world, but bringing in entrepreneurs and social engineers and people interested in that dynamic is what is the critical, essential aspect, empowering aspect of WAY's engagement in this dynamic dialogue. So going forward, what do we do? Infuse, how do we bring an entrepreneur, social entrepreneur, to get together with a health geographer, together with an epidemiologist, together with a physician around specific aspects of women's health and community? And how do we engage a technologist to say, how do we amplify this to a level that it gets not only filtered back to the women in the community, women on the ground, and how they use technologies, but also a broader context? So I feel that all 17 SDGs are critical here, but specifically SDG 5, because it relates to the empowerment of women, and SDG 3, which relates to health. So the intersection of that, I think WAY is playing a very critical role in itself, having this meeting, having this conference, engaging the multi-sectors, is already a step in the right direction. We have 10 years to achieve the SDG goals. Short space of time, we're all panicking because we're nowhere near where we need to be, but WAY is one of those civil society organizations that can help to move the needle by bringing together this multi-sectoral, multidisciplinary perspective to the focus on the economic empowerment of women at all levels, from the family all the way up to the global scale. You're very welcome. I'm glad to help.